Irregular periods. One's period is considered irregular if it is longer than 38 days or if the duration varies or differs. Irregular periods can have several causes, from hormonal imbalances to other underlying conditions, and one should go and consult with a doctor if the condition gets worse. Journey with us as we get to learn more about irregular periods through a case presented by a patient. In this scenario, we have Sizwe who's concerned about her delayed periods. She then decides to consult with a doctor. The doctor will then do a case taking and perform necessary examinations. A pathologist will explain the testing and interpret the results. A consultant who will now explain to us some differentials and explain how to differentiate between them. The management will then explain to the patient the treatment options and how they work. Our technical director will make the video editing.
Greetings again, I'm Dr. Madlala and you are?
I'm Sizwe Zulu.
Okay, Sizwe, how may I help you?
Doctor, my menstrual cycle is irregular ever since I started using contraceptive.
Okay, when did you start your periods and what kind of contraceptives are you using and when did you start using your contraceptives?
I started my period when I was 14.
Okay.
Then I was using depot injection at the age of 17.
Depot injection?
Yeah, depot
Okay.
injection. And that is when I gained weight and I started noticing acne.
Oh, okay. So how are your periods? Are they heavy or light? And also how are they irregular? Like you skip months or you go twice a month? Like please explain that.
I can say they keep on fluctuating, sometimes 3 to 4 days of heavy bleeding, and I felt a lot of period pains, painful period pains at my lower back.
At your lower back?
Yes, at my
Okay.
lower back. And I become bloated.
Okay. All right. So now let's talk about your past medical history. Are there any diseases that you were previously diagnosed with? And also, are there any diseases that you have in the family? Maybe your mother, your father, your grandmother. Please tell me more about that.
After I had miscarriage, I was on hyperthyroidism treatment, but I'm not sure if it was the treatment or not, because every time I was doing the deeds,
Okay, that did.
yes,
Okay.
it was more of pain than pleasure.
Oh, so it was painful.
It was so much painful.
Okay.
And my mother was once diagnosed of amascancy, periods, and dysmenorrhea.
Oh, okay. So that's your mother.
Yeah, my mother.
Tell me about your lifestyle. Are you a healthy person? Do you exercise?
I cannot say I'm healthy because I don't like to cook. I eat takeaways and junk. In terms of exercising, I don't like to exercise due to being always busy with schoolwork and it stresses me out. So in few months I've noticed that I urinate on a regular basis even when I did not drink a lot of water.
Since you're studying, what are you studying? And since you said it stresses you out, how do you cope?
I'm a third year sports science student and there's a lot of work, so I usually smoke to cope.
Okay, that's very normal because at an early ages, one can experience irregular periods maybe around the age of 14 to 18. And also, people experiences a lot of changes during that time because we have different causes of irregular periods. Irregular periods can be caused by many things like menopause, family diseases that are inherited, or the contraceptive that you're currently using. Sometimes it happens that you have your own disease like fibroids since you are heavily bleeding. So we're gonna look at different things. Okay, so Sizwe, I'd like to ask your permission to perform abdominal examination and take blood tests and submit them to our pathologist. May I have your permission?
Yes, doctor, you can proceed.
Okay.
So now, Dr. Madlala and Sizwe proceeded to perform some abdominal examinations and to take some blood tests to present to our pathologist, Sizwe Zulu.
Okay, so Sizwe, now we're gonna start by doing the vitals. I'll start by checking your blood pressure and then move to your temperature, your pulse rate, your height and weight. So, Okay, so now we're gonna do Jekyll. I'll start by checking jaundice, move to anemia, check clogging, check cyanosis, check lymphadenopathy, your lymph nodes, and then check dehydration. So can I take off your mask? Thank you. So let's start. So after taking this blood test, I'm going to submit them to our pathologist. Yeah.
The blood test, vitals, Jacob, and abdominal examinations were a success. And disclaimer, this was not real blood.
Okay, Nasa, I need your urine. Please go pee. You know what to do, right?
Yes.
Okay.
As alluded, Dr. Madlala is now taking the blood test and is now presenting them to our pathologist, Slondiwe Poso.
I evaluated the blood and urine samples respectively. The blood test. I did a complete blood count. This test evaluates your overall health as well as check for any underlying conditions. It mainly concentrates on white blood cells, red blood cells, and platelets. It shows if any medication you are currently taking is working to make you better and will finally help us find a diagnosis for you. The results show that your white blood count is higher than normal, red blood cell count lower than normal, and the platelets were also higher than normal. So, when your white blood cell is high, it could be caused by blood loss during your monthly periods, and that blood loss can lead to anemia. Anemia is a condition when your red blood cells are low, thus they do not carry enough oxygen to your body organs. Anemia is seen in people with heavy periods or condition like fibroids. When your white blood cell is abnormally high, it usually suggests that your immune system is fighting a disease or infection. Could also be that there is a reaction to a drug that increases your white blood cell production. Moving on to the urine test. This procedure uses a thin plastic strip treated with chemicals. It's dipped into your urine and the chemicals on the stick react and change color if levels are above normal. The dipstick shows acidity or pH, protein, glucose, white blood cells, nitrates, bilirubin, or blood in urine. So the dipstick turned yellow when it was placed in the urine. This color change shows that you have an alkaline urine. An alkaline urine suggests that you could be having a urinary tract infection. Since you've been experiencing heavy irregular periods and you've had a miscarriage before, you are therefore expressing symptoms of uterine fibroids. Thank you, Dr. Madlala.
This is our consultant, Fanelist Bonge, who will give us clarity on the differential diagnosis and then conclude on the specific diagnosis for the case.
We'll be discussing differential diagnosis of irregular periods. Firstly, uterine fibroids. Uterine fibroids are tumors which are not cancerous that grow inside and outside of uterine. They cause periods to be irregular. They cause lower back pain, heavy bleeding, which lead to anemia. Other diagnosis is uterine polyps. Uterine polyps are similar to uterine fibroids. There is an outgrowth on outside of uterus, which cause a heavy bleeding during periods and cause anemia, a lower back pain, painful during sex. The diagnosis that was found is uterine fibroids. After we ran some tests, we did MRI, and we saw a clear image of fibroids, and we saw that the fibroids are not endometrial. They are fibroid tissues that were outgrown in the uterus. That's how we came up with the diagnosis of uterine fibroids.
Our management coordinator, Sengobile, will be explaining different treatments to our patients and how they work.
Hi, Sizwe. My name is Mobile Twala. So I'll be explaining the treatment that you'll be taking since we've discovered that you have uterine fibroids. So you are using a depot injection. We will change you from that and use birth control pills. So you take one every day. They'll explain it to you at the pharmacy. So you take the birth control pills, which will help you with heavy bleeding, decrease your anemia, and you're cramping since you said you have painful menstrual. So we'll also give you the Lipron injection. So we'll take it once every month. So take one shot every month. It will help you to shrink the fibroids, also decrease anemia, and will help you if you want to remove the fibroids. Maybe if you're going for a surgery, it will make it easier for surgeons to remove your fibroids. So we will also give you the vitamin D supplement and iron supplement, which will help with the energy, since you said you're always tired. So it helps with energy, shrinks fibroids as well, and help with anemia. So if you want to remove the fibroids, like you want to go for a surgery, there are different types of surgery, and we will explain that once after 6 months, because the treatment will take it for 6 months. You're not allowed to take it more than that, due to they will cause your bones to be weak. So we will do surgery after 6 months if you want to remove the fibroids, and the surgery will depend if you still want to have children, or if you want to do surgery. There are different types of surgery, but we will explain that once you come for after 6 months for the surgery. So it depends on if you still want to have children, and it depends on the size of the fibroids. So yeah, thank you. We'll go to the pharmacy and get your treatment. Thank you.
Among the tests that were conducted by Dr. Madlala were ultrasound, MRI scan, pap smear, and heteroscope. As alluded, our patient Sanelisiwe was diagnosed with uterine fibroids. I, the narrator Sizwe Zulu, and my team managed to complete the irregular periods case, and it was a success. So I guess it's a wrap. Thank you.